Well, I am a major or big believer in preventative medicine. I like to approach medical care from a preventative standpoint in that we try to look at the total patient and through their health habits, eating habits, lifestyle, prevent them from catching some of the major diseases that inflict most Americans. The goal for each patient visit is to first establish a relationship with the patient and hopefully be able to gain their confidence and assure them that my objective is to make their health their number one priority. And if we're able to do that, then based on that relationship, we can frequently go into a situation where they trust the medical system, where they understand what my objectives are, what our office's objectives are, what Providence's objectives are, and try to achieve their goals as well as my goals, which is to make them as healthy a person as they could be. Internal medicine has always been an interest of mine because it's a study of the internal organs of the body. Secondly, it encompasses the majority of major life-threatening diseases that most Americans are afflicted with. And I've always felt that you have to look at those diseases that really can cause major illness to prevent them and then help patients and help citizens become a more productive and increase their life expectancy. I think they would describe me as interested in their well-being. I think they would describe me as someone with a sense of humor. I think they would also describe me as someone who doesn't take himself too seriously. And even more importantly, as someone who really wants to include them in their medical care and make the patient the center of focus and not my objectives as a doctor or the objectives of Providence Medical Group, but to really make that patient the center of everything that we do. I love to come in and see someone who is really frightened about a potential diagnosis, concerned about their future outcome in terms of their health and in terms of their ability to provide for their family and themselves, and turn that around to make them see how they can strive and feel much better than they did when they first saw me. I also think it's really important, and I feel good about it. The profession that we're in is going through a lot of transformation and change right now. We just had a health care bill that was passed where all Americans will receive full health care, and this is a very exciting time to be in medicine. So I feel really engaged when I'm with patients, in the office, and when I go home.